안녕하세요. 저는 장혜미입니다. I'm a partner and co-chair of the Life Sciences Group at Foley Hoag. 서울에서 태어났지만요, 3살 때 떠나가지고요, 우리나라 말이 좀 짧아서 영어를 말씀드리겠어요. Foley Hoag is a top international law firm based in the #1 United States biotechnology area, Boston, Massachusetts, with offices in New York, Washington, D.C., and Paris, France. Our firm is very well known in the biopharma industry. I am the leader of my law firm's Licensing and Strategic Alliances Group, and am pleased to be discussing licensing and intellectual property matters with my colleague and partner, Dr. David Halstead. David Halstead is the leading biopharma patent prosecutor in our intellectual property group, handling many Korean company matters.
My name is Dr. David Halstead. I'm a biopharma patent prosecution partner in Foley Hoag's Intellectual Property Group. We have over 800 clients in the biotechnology, pharmaceutical, and medical device fields, which we are proud to say include almost a dozen Korean companies, such as Bioneer, Dong-A, Legochem, and Olipas, in addition to the Republic of Korea. We also represent large public companies such as AbbVie, Baxter, Gilead, and Shire, as well as famous academic institutions such as Harvard, the California Institute of Technology, or Caltech, the Massachusetts Institute of Technology, or MIT, and the University of California. We are pleased to provide the full range of services to Korean companies, from corporate advice in mergers and acquisitions, initial and follow-on public offerings and financings, setting up a U.S. subsidiary or contacting U.S. investors, obtaining work visas for Korean nationals in the U.S., leasing office and laboratory space, and of course, licensing deals and intellectual property advice. So Hamy, last year you did over $3 billion worth of deals. What information can you share about what's driving the value of these deals and how to set up a good collaboration?
I think the fundamental issue here is breakthrough science, and Korea has been so well known for their talents and the cutting edge technology they have. So as in all deals, I believe science is the driver, and so it's so exciting to see a number of the transactions, including those David, you and I have worked on together, really drive the whole industry. Last year, Hanmi had the largest deal, I think over $4 billion with Sanofi, as part of Sanofi's push to really get into the diabetes space. And as you recall, you and I worked on an early stage deal for Olipas opposite Bristol Myers Squibb, which again was very much driven by the science and innovation. So really, I think that every deal is different, but the value is driven by that fundamental desire to find cures, to find, innovation.
I remember working with you on the 2014 Olipas deal with Bristol Myers Squibb, which was a very early stage deal on their peptide nucleic acid platform. Some of these early stage deals are really huge deals. Why are these early stage deals becoming so valuable?
Well, I think as you'll see in the numbers that we have looked at, preclinical and clinical stage assets are now becoming very comparable, in part because partners are trying to get into this area sooner than later. And I think that that really drives the opportunity or the desire to get into a new space that a partner may not have been in before. And that really creates the most benefit to both sides. On a risk-adjusted basis, really I think the most value, even though you like to see the big numbers, the most value is really in, can we work together? Can we deliver a successful product at the end of the day? So I think that's critical. And so knowing your partner, getting comfortable, is really a very strong element to these deals.
So, Amy, what can a company do to keep the most value for itself?
David, as you know, there are many different ways you can reserve value for the company. And in this case, many of our Korean companies have reserved, for example, Korea or Asia, or the ability to co-promote in certain territories where they feel they have a sales force. It's also important to look at fields. We've been talking about some diabetes and obesity deals. So for example, if you know your product is going to be effective in both diabetes and obesity, you might decide, depending on the value that your partner is giving, to reserve diabetes for yourself or obesity and to partner the other indication out to your partner. And finally, there are all sorts of different innovations happening in agricultural biotech products, even in animal health products. So you can think about whether you can reserve certain indications to yourself and certain fields that may not be as obvious and just limit some of the partnering to human applications.
How do you determine what the proper value for a product is?
Well, that is always a difficult question, and sometimes I feel like not everybody has the benefit of some of the resources that larger partners or we have, particularly outside of Korea and Asia. So for example, we have internal data research services, both public and private, that we can really use to the benefit of our smaller clients and Korean clients who may not be aware of worldwide deal trends as readily as some other partners.
Thank you, Amy. That's very valuable information, and I feel like I understand a lot better what makes a deal so valuable. It sounds like it would be a good idea for interested companies to contact you at an early stage to make sure that their contracts are set up properly from the very beginning.
I cannot agree more, David, and we believe we can be very cost effective. Even early stage matters, simple agreements such as academic in-licenses, early development agreements, option deals, even supply and manufacturing deals can be critical to make sure you get some of the elements right so you can be sure to do a good deal in the future. David, I am sure that you have, through your decades of experience, not only representing smaller companies, but also large pharma such as Pfizer, some insights into how Korean companies could do better with their patent portfolios.
Well, let me tell you one example. So I had a client who was interested in licensing some anti-cancer compounds from a small Korean company. But when we started looking at the IP, we discovered some problems.
So what kind of problems did you come across, David?
Well, one of the issues arose because the research and development program began with a university collaboration. So for several years, the company worked with this university, developed some compounds, but then the collaboration kind of ended and the company continued to develop some more compounds. And it was some of these later compounds that my client was interested in.
So that seems to be something that happens all the time. What would you have preferred the company had done?
Well, there's nothing wrong with conducting a research program that way. But the problem is that their original license agreement with the university was not very clear about when the university's rights would begin and when the university's rights would end. So my client was not certain whether the university would think that they still had rights in the compounds that the company developed after they thought the collaboration was over. And in fact, we asked the Korean company to go back to the university to confirm that they did not feel that they had rights in that technology, but actually, they didn't agree. And what's worse is they really wanted to collaborate with a different US company, not my client, and so that would have put my client in a very difficult position.
So that sounds like a big problem, David. How did you deal with it, or were you able to deal with it at all?
Well, unfortunately, that was only one of the problems in the portfolio. The other problem is the way that they filed their patents, which was following a very simple patent strategy. They would develop a series of different compounds, and each time they developed a new series, they would file a couple of patent applications, get a couple of patents, and move on.
So that patent strategy doesn't sound so bad, David, filing multiple patent applications and getting them issued?
You're right, but the problem is that by the time my client came on the scene, all of the patents for the compounds they were interested in had issued. Some of the claims were very, very broad, and so my client was concerned they might be invalidated in litigation. The other claims were extremely narrow, and so the slightest change could create an issue that would allow a generic company to enter the market. So because there were no claims in between that my client felt could be relied on, that was something we viewed as a problem.
But David, you've had spent a whole career fixing problems like this. Do you think that this was something you could have fixed?
Well, you can fix it, but fixing an issued patent comes with a lot of risk. You have to hand your patent back to the patent office, and when you do that, the examiner can raise new issues. They can raise issues that you thought you dealt with before. And so the claims that you had issued in your patent originally may not come out as a patent again.
So you're saying you could potentially lose the entire patent itself?
That's correct, and obviously that's a big risk. And that's just the US. You know, in Europe, if you're going to try to correct something like that, it's possible to add new claims, but you can only do that by canceling an equal number of claims that are already in the issued patent. And the European patent here had very few claims, so it created quite a dilemma as to how we could possibly fix the claims without giving up something very important. And this is why a lot of US and European pharmaceutical companies and biotech companies keep applications pending, especially important applications, in the US and sometimes even Europe.
So that could be potentially expensive, if you don't mind me asking you, David, because sometimes with the development cycles, etc., you could maybe have to leave these applications open for a decade, potentially more?
Well, indeed, that's something that happens very often, but by having these pending applications, you preserve the opportunity to present new claims, present different claims, and react